If you get your health insurance from your employer, and most of you do, you probably will lose it. That's according to experts who say it is not a matter of if, only when. Chief National Correspondent Jim Angle says the reason is a familiar one, and he says it's Obama.
Across the political spectrum, analysts are now saying that 80 to 90% of employer-provided insurance, the mainstay of American health coverage for decades, will disappear as Obamacare takes hold. The research firm S&P IQ predicts less than 10% of those who get insurance at work will still get it 10 years from now.
The companies will really be hard-pressed to justify why they would continue to have to spend the kind of money they spend by offering insurance through corporate plans when there's an alternative that's subsidized by the government.
Even a former advisor to President Obama, Zeke Emanuel, predicts less than 20% who now get employer-provided insurance will still get it 10 years from now, writing in a new book that, quote, by 2025, few private sector employers will still be providing health insurance.
It's going to actually be better for people. They'll have more choice. Most people who work for an employer and get their coverage through an employer do not have choice.
The reason analysts see this historic change in health coverage is because the tax penalty for not offering insurance, $2,000 per worker, is so much less than the cost of providing it.
For a worker making only $15 an hour, typical employer coverage for a family costs $15,000 or $16,000. That's more than half of that worker's annual wage.
It will be too compelling for companies to not put their employees into exchanges.
To also make it compelling to workers, employers can bump up workers' pay to help cover deductibles and other costs in Obamacare.
You could give them more so that after tax they end up with the same, and the math still says you come out ahead. And so employers have been doing this math ever since the law passed. I expect them to get to the exits pretty quickly.
Because employers would also get rid of the headache and uncertainty of providing insurance.
Most people are not in the health insurance business. They're manufacturers, they're exporters, they're service providers, and they'd rather stick to that than worry about health insurance.
They don't want to be in the health insurance business, so if they see a low-cost way to get out of it, many will jump at the chance.
So employers could offer more pay to the workers, pay the fine, and still come out ahead, while workers would still get health care. The only losers would be the federal deficit and taxpayers, as many workers going into Obamacare would qualify for subsidies, driving up the cost. Brett?
We'll follow this one. Jim, thank you.